So today we're doing trach care and trach suctioning. As always, knock on the door, hand hygiene, put on gloves, and identify your patient with 2 identifiers. First, we're going to be starting with the suctioning. We're going to assess our lung sounds, respiratory effort, and oxygen saturation level. As we are doing this, we should have already obtained our suction kit and sterile suction catheter. You want to apply a face shield, obtain a flask of normal saline, and a suction machine. And so what we're doing now is setting up our sterile field. We're going to turn on the machine for 100 to 150 millimeters of mercury for an adult, 100 to 120 for a child, and 50 to 95 for an infant. We are going to open the container of saline before donning our gloves, pulling the privacy curtains and elevating the head of the bed for the patient, as well as pre-oxygenating until we hit 95 to 100% SpO2. Once the sterile gloves have been donned, we are setting up our container to hold our saline, which will be poured with our non-dominant hand, considering this hand now contaminated. Once we have poured the saline, we are going to pick up our suction catheter with our dominant hand and place the catheter tip into the saline and include the vent. When it comes to tracheal suctioning, we want to wait until the client takes a deep breath before advancing the tubing until the patient coughs, and never occlude while entering the trach. We want to occlude the air vent and rotate the catheter as it's withdrawn. Complete the process in no more than 15 seconds from insertion, and do not vent for longer than 10 seconds. We want to rinse the secretions from the catheter by inserting the tip in saline again and applying suction. Always provide a period of rest for the client and a suction again if necessary. Remove your gloves and perform hand hygiene. To begin trach care, we would have washed our hands, placed the client in a supine or low forward position, and remove the soiled dressing. We would then wash our hands and possibly perform an alcohol-based hand rub. And now we are going to set up our sterile field by opening the kit, setting up our sterile drape, pouring the contents onto that without contaminating the contents. We now put the stoma into the basin. This is the saline being poured into all 3 sections, and then the hydrogen peroxide being poured. We have performed hand hygiene again right before placing our sterile gloves on. Once our gloves are on, we are going to clean the inside and outside of the cannula with pipe cleaners or a soft brush, picking up the cannula from the container with only the non-dominant hand. Make sure to dispose of all contaminated supplies in a lined or waterproofed waste receptacle. Rinse the clean cannula in the basin of normal saline, and then tap the cannula against the edge of the basin and wipe off the excess solution with a gauze square. Replace the inner cannula by turning it clockwise within the outer cannula. We are then going to clean around the stoma with an applicator moistened with normal saline, making sure to never go back over an area once it has already been cleaned. Place the sterile stomal dressing beneath the phalanges and outer cannula of the tracheostomy tube. Then change the ties of the tracheostomy and wait to remove the previous ties until after the new ones have been secured. Discard appropriately and wash hands and document.